U.S. has been aggressive in increasing police presence in an effort to minimize drug epidemic impacts, but it has largely failed to address the underlying structural issues contributing to the epidemic. Epidemics vary in severity based on the rate at which they impact the population and the mortality rate of the particular drug abused. For example, the recent opioid epidemics that span several countries and are concentrated in many cities are very severe because of the very high risk of addiction and the high rate of death caused by overdose. Montreal's drug epidemic features a wide array of illicit substance and prescription medication abuse. The border stretches for nearly 900 kilometers through some of America's most remote and uninhabited wilderness. When we're talking about Canada, the drugs flowing back and forth that cross the border are often difficult to detect because they have a very non-populated border. There are miles and miles and miles of wilderness, and people can boat across, people can hike across. Drug gangs are starting to change their tactics by growing their marijuana plants in unexceptional places among the trees. Most of the drugs made in Montreal, Canada are entirely synthetic. They're extracted from industrial chemicals and everyday products like cold medicine. They mimic highs from organic highs but are cheaper and readily available and are made in our backyards. Canada is the world's third largest producer of the most popular designer drug, ecstasy or MDMA. Opioids and fentanyl in particular are the most abused substances in Montreal that contribute to the highest rates of overdose and death. More recently, fentanyl has increased heavily in supply in Montreal, creating a decrease in its pricing. The result is that more people are turning to fentanyl for pain relief as an alternative to prescription opioids and as a means of achieving a high. The relative ease at which the drug can be obtained is contributing heavily to its abuse. As a cheaper alternative to heroin, fentanyl carries a very high risk of abuse and overdose. An overdose of fentanyl is very often lethal. The increased rate of opioid-related deaths in Montreal is strongly linked to the increased availability and use of fentanyl. Now, one of the major problems facing efforts to combat the drug epidemic in Montreal and Canada more generally is the lack of reliable statistics on drug abuse. Since June 2017, there have only been statistics kept for Montreal in which 95 deaths were related to excessive drug use. Seeing as these deaths are at the forefront, the police force and the first responders are sounding the alarms about the potency of these new drugs on the market. On top of being easily accessible, notably for youth, the drugs are often cut with other synthetics which ravage the body. At the heart of it all, fentanyl is currently the new hot ticket item. It exists as pills, powders, and as patches, in addition to being injectable. Fentanyl is 40 times stronger than heroin and 100 times stronger than morphine. 4 granules of pure fentanyl salt, about 2 milligrams, can be enough to kill the average adult, according to the Royal Canadian Mounted Police. This drug alone is responsible for more than 50% of the deaths when involving opioids overdose in Canada. Montreal is therefore the ideal city for assessing the drug epidemic because it both is facing a major epidemic and has had the most statistics on drug abuse. While there are other forms of opioid abuse occurring in Montreal, fentanyl appears to be the most problematic and influential because it has flooded the Montreal market and has decreased in price substantially. While the drug epidemic in Montreal is concentrated on opioids, there are other major drug crises impacting the city. Cocaine and methamphetamines remain significant sources of abuse and overdose in Montreal. Though not on the level of severity and magnitude as the opioid crisis in the city, both cocaine and methamphetamines continue to be accessible in the city. A major feature of the efforts to thwart the abuse of cocaine, methamphetamines, and other drugs that are either illicit or require prescription is that the Montreal lawmakers and Canadian lawmakers more generally have entertained the idea of legalizing these drugs in some forms for personal use. This is because many of the major problems associated with their use stem from misuse and the dangers of the production and sale of illicit drugs. For example, cocaine in Montreal has been found to be laced with other substances, including fentanyl. Therefore, the legalization of these drugs for personal use may help regulate such drugs and diminish the risk of consuming such drugs. Another important feature of Montreal's drug epidemic is the spread of diseases, especially through needles. Various strains of diseases have been found to be spread by needles as part of the drug epidemic. Diseases such as hepatitis C have increased in frequency in part because of the increased needle usage. The increased needle usage is caused by a number of factors. One of the factors is illicit drug use. As illicit drugs become more available, the prevalence of individuals using such needles increases considerably. However, prescription drug use has also contributed substantially to the increase in the spread of certain diseases in the population. In particular, prescription opioids self-administered by needle have been found to contribute to the spread of diseases. The misuse of needles intended for a single patient to administer prescription opioids appear to help spread diseases such as hepatitis C. One of the major concerns of Montreal's drug epidemic is that it will contribute to a high rate of disease within and around Montreal.
On n'est pas capable de gérer la crise qui va s'en venir. On va avoir beaucoup de problèmes bientôt. Je pense que présentement, il y a eu quelques incidents qui sont arrivés. Ça a été colmaté, comme on pourrait dire. Par contre, je pense que plus en plus, l'épidémie s'en vient et on va avoir beaucoup de problèmes face à cette épidémie parce que c'est rendu à Ottawa, alors ça prend juste ça sera pas long que ça va venir à Montréal. Que moi, les patients qui viennent me voir, c'est souvent plus des opioïdes, fait que l'héroïne, mais de plus en plus les médicaments. Alors, les dilodides, les hydromorphes, Contin, le fentanyl en patch, parfois aussi, je peux avoir beaucoup. Alors, c'est vraiment plus côté downer, comme on pourrait dire. Alors, j'en vois plus, mais dans la rue, c'est vraiment aussi beaucoup de cocaïne fumée. Alors, c'est du crack. Pour la plupart, il y en a vraiment beaucoup à Montréal. Mais moi, ici, dans mon bureau, c'est vraiment plus des opioïdes. Ici, des fois, il y a une pharmacie que là, on voit qu'il y a beaucoup de patients qui vont là, puis les patients vont s'attendre dehors, vont essayer de commencer à dealer par rapport à leur pilule. Et puis, ça va être souvent alentour de pharmacies ou alentour de certains points stratégiques comme le métro ou comme les ventes. T'sais, ce coin-là est réputé pour une vente, fait que là, ils vont tous se tenir un peu plus dans ce coin-là. Alors, ici, dans le centre-ville, Atwater, mais Peel aussi. Peel est un bon point de vente. Sinon, Hochelaga, dans l'Est, surtout Sainte-Catherine, on peut avoir beaucoup de personnes qui vont consommer, mais ça va être surtout aussi par rapport aux points de vente, puis des fois les pioles. Dans l'Est, c'est plus Hochelaga.
In 2012, the Canadian government attempted to control the country's problem with prescription drug abuse. They took drastic steps so that the popular drug at the time, oxycodone, also known as OxyContin, was produced in an anti-temper tablet form to prevent the pills from being abused for recreational purposes. This approach had devastating effects on the population, and those people addicted to OxyContin, which is an opiate-type drug, turned to alternative opiates to deal with their withdrawal symptoms. Now, the drug fentanyl that is striking the streets of Montreal is a super strong drug of the opiate class that is used to treat severe and chronic pain associated with cancer, major trauma, and major surgery. It was merely produced in a stick-on patch forms that were intended to last patients 3 days, but people would obtain the patches on the black market and extract the drug from the patches. Over time, a market emerged as demand for fentanyl grew. And of course, as a market emerges, there's profit to be made. And wherever there's profit, there's organized crime.
So, my name is Cash, and I'm from Montreal, born and raised. So I'm going to talk about the way I became a dealer. It was just a friend of mine back in the days who showed me the game about selling weed, and I started as a worker. And then quickly I became my own boss because I wanted to get my own money. So that's it, you know. Started like maybe 15 years ago. And pretty much it's really cool and I like it. Take a risk sometimes in the day or, you know, it's never bad to make money on the side. Number one drug, I'd say weed, of course, because everybody smokes weed, and since it's legal, there's more people who's willing to smoke it. And for other drugs, I would say coke. You know, it's a really it's a casual drug. You know, I know a lot of people who take that. And I would say Molly's, and what else? And I know there's that drink that people like to drink. It's called lean. It's not that easy to find because you know it's not a lot of people who has it, but I know a couple of people who can put their hands on it. In the beginning, not even in the beginning, because I'm well aware of how it works. You know, I'm really careful. I don't deal with people who I don't know. Like, let's say people would come to me like for $100. Like, I don't care if I don't know you. I'll just say no, because I already got caught up like that with, let's say somebody that comes to me and I don't even know if it's a cop. I just say yes. We go through the transaction and bang, police. They show the badge and everything. It can happen, but I'm not afraid of doing this because I know how to do it, so there's no need for me to feel stressed about it. But when I see something's wrong, I just get away and, you know, come back later.
Detroit, the most dangerous city in the USA, where even the dealers find it hard to earn a living. The city of Detroit is financially broke and fighting to survive. But with so many addicts in the city and surrounding suburbs, drugs in Detroit will continue as a booming enterprise. Detroit street dealers are suffering financially, but the personal risk they face remains the same. With the city struggling to balance a $197 million budget deficit, Detroit's police have recently had their pay cut by 10% and are working longer shifts. Increased street crime deters customers and hurts businesses. Detroit's PD had a $75 million cut from their budget, so federal law enforcement agents such as U.S. Border Patrol provide an important support in the fight against drugs. Detroit is not like any other major U.S. city. It sits on the border with Canada, one of the world's largest producers of MDMA and a major supplier of marijuana to the U.S. market. The Detroit River separates the two countries. The Border Patrol in Detroit is very unique because their agent patrol in a very urban environment. The city lies right on the border. This border runs right down through the heart of a major metropolitan area. You have abandoned buildings, abandoned warehouses, abandoned properties. It is kind of a haven for the drug smugglers in the Detroit area to utilize these areas where it is desolate. The drug epidemic in Detroit tends to be heavily concentrated in areas of high density and poverty. The result is that cycles of drug use and selling drugs are established which attract the youth into social groups that are driven by selling drugs. Detroit has also been one of the most impacted cities in the U.S. opioid epidemic due to its heavy population density and ease of access to illicit drugs such as heroin. However, in contrast to other cities in the U.S. with an opioid epidemic, Detroit has a drug problem that is most heavily concentrated on the use of non-prescription opioids such as heroin. In many other cities, the opioid epidemic originates from a high rate of opioid prescription, leading to the abuse of prescription opioids and often culminating in a dependency on opioids that leads either to prescription overdose or transition to illicit opioids such as heroin. The occurrence of abuse and overdose on prescription opioid painkillers is often the result of opioids being prescribed too often. Yet in the case of Detroit's opioid problem, prescription medication abuse is less of a problem. The very high illicit drug use rate is a much more pressuring problem despite still significant rates of prescription opioid abuse in the city. Detroit has responded to its drug epidemic with the implementation of major policies. Now, for example, the city implemented policies that were aimed at reducing the prescription of opioids. There were requirements that every prescription of opioids to be recorded and held in a register to keep physicians responsible and accountable for their opioid prescription. Other policies were aimed at creating programs to provide addiction recovery, clean needles, and healthcare support for those who are at risk of abuse or who have already become addicted. It is difficult to determine whether these policy changes have had positive effects, given the prevalence of drug problem in the city. In general, they have not been reduced or effectively addressed. Though Detroit's most severe drug problem involves illicit drugs such as heroin, fentanyl, and various methamphetamines, have also generated major problems in Detroit. Each of these types of drugs has contributed to overdose-related deaths in the past several years, and there are recent trends suggesting that abuse for each of these may be getting worse. There are major connections between domestic drug markets across the US and into Canada and Mexico. Yet each individual market tends to have specific characteristics and independent channels for the accusation and distribution of both prescription and illicit drugs. A number of illicit substances in Detroit that have contributed to the drug epidemic originated from either Mexico or South America. In fact, there are strong connections between illicit drugs in Detroit and suppliers from Mexico. Other drug networks have been linked to South America sources as well. Drugs such as fentanyl are predominantly related to Chinese sources. Fentanyl most often arrives in the US, enters US ports from China. One factor in the ongoing drug epidemic in Detroit is that police face major barriers in enforcing laws and stopping illicit drug networks. Though Detroit has a prescription opioid problem, its major drug issues involve illicit drugs including opioids, methamphetamines, and cocaine. Enforcing the existing drug laws is difficult in the city, while there has been insufficient progress made in introducing policies that minimize demand for illicit drugs. Current drug law enforcement in Detroit is convoluted by the complex illicit drug networks in the city that create constant supply channels of illicit drugs. In addition, gang activity in Detroit increased the threat of violence for drug investigations. In order to combat illicit drugs in Detroit, police should increase focus on detecting and halting the major illicit drug sellers in the city. That identification of the major drug sellers can be difficult as there are no long networks of dealers that can replace one another when one is arrested or detained. These major barriers have restricted the ability of police to reduce the flow and sale of illicit drugs in Detroit. The following Table 1, displays recent data on drug trends in Detroit. In particular, the table shows the patterns of drug-related clinicals and hospital visits in Detroit. There are clear similarities and differences between the drug epidemic impacting each of these cities. First, the drug epidemic in Detroit is concentrated in areas of high density and poverty. That is, there are certain areas in Detroit that produce the majority of the drug abuse in the city. In addition, Detroit has been one of the most impacted cities in the US opioid epidemic. That is similar that it shares with Montreal, which is facing a major opioid epidemic itself. Unlike many cities with an opioid epidemic, Detroit's opioid epidemic is concentrated on the use of non-prescription opioids. This is also the case for Montreal. However, Montreal's drug epidemic features very heavy use of fentanyl. Heroin remains a major problem in Detroit, maybe even more so than in Montreal. In many other cities in the US, the opioid epidemic stems from and tends to begin with a high rate of opioid prescription. Overdose on prescription opioid painkillers is often the result of opioid abuse in such cities. However, Detroit's opioid problem is less tied to prescription medication and more associated with a high illicit drug use rate. This is another similarity between Montreal's drug epidemic and that of Detroit. Nevertheless, there are still significant rates of prescription opioid abuse in Detroit as there are in Montreal. In 2017, Detroit implemented policies that were aimed at reducing the reckless prescription of opioids by requiring every prescription of opioid to be recorded and held in register. Now, Montreal has implemented similar policies, but is now more focused on potential legalization of non-opioid drugs that are currently illicit. In addition, Montreal is heavily focused on minimizing the illegal importation of fentanyl. Methamphetamine use in Detroit remains very high. As mentioned earlier, 9 counties in Michigan have been designated by the federal government as high-intensity drug trafficking. Such counties all have high rates of illicit opioid and methamphetamine use. There are similarity patterns of high usage of illicit drugs in and around Montreal. The counties include Detroit and several surrounding areas, suggesting that there are entrenched drug networks in and around Detroit. A major contributor of the ongoing drug epidemic in Detroit is the difficulties that police face in enforcing laws and stopping illicit drug networks. While Detroit has a prescription opioid problem, its major drug problem involves illicit drugs including opioids and methamphetamines. Drug law enforcement in Detroit is complicated. The well-established illicit drug networks in the city. To combat illicit drugs in Detroit, police focus on detecting and stopping major illicit drug sellers in the city. However, this can be very difficult given the high density of the parts of the city where drug use is prominent. Identifying the major drug sellers is particularly difficult as there are long networks of dealers. Identifying a single dealer may not lead authorities to the importer. The distinction between the types of opioids that are most problematic in each city is important for identifying the different types of problems faced in each city. In particular, Detroit's heroin issues may be combated in very different ways as Montreal's fentanyl issues. The former is concentrated on minimizing the supply channels of heroin into the U.S. and in Michigan more broadly. The latter is concentrated on combating Chinese imports of fentanyl. Moreover, the heroin market in the U.S. has strong connections to gangs and complex drug networks that provide other types of dangers to the population. In contrast, fentanyl distribution channels tend to be less associated with gang activity and may be concentrated in the medical networks within Canada and the US. It may be the case then that Montreal's primary drug problem most heavily involves issues within Canadian medical systems, while gang activity in Detroit may be driven drug activity in Detroit. For policymakers seeking to address these issues, there may be very different approaches taken. In addition, Detroit policymakers may have additionally considerations when considering how to combat heroin issues in the city, as gang activity can create major security threats. The current approaches taken in the two different areas also mark major distinctions between the two. In particular, Canada has been much more active in both the recognition and funding for programs to combat its drug epidemic, while the U.S. has focused primarily on increasing recognition and ignoring funding. The U.S. should increase efforts to combat its opioid epidemic, especially in cities such as Detroit. Canada has provided a strong model for recognizing the sources of its major drug problem and working toward addressing them. Both Detroit and Montreal nevertheless continue to face distinct drug epidemics. The results of the comparison reveal that policymakers in the US and Canada should focus on reducing the demand for illicit drugs and opioids. There are opportunities for both countries to reduce the demand for opioids by introducing alternatives such as medical cannabinoids. In addition, the two countries could benefit from greater levels of coordination, especially in combating the flow of opioids into North America. China remains the primary source of opioids like fentanyl in both the US and Canada. As such, both countries should focus on their treaties and joint drug enforcement operations on identifying the methods used to transport fentanyl and similar opioids in North America. After all, if one country fails to adequately reduce the amounts of opioids being imported into the country from China, then the other country may not get the desired decreased levels of opioids. The cases of Montreal and Detroit reveal the importance of a supply and demand approach to combating drug epidemic. Reducing supply completely is impossible, but reducing it some can help reduce the impact of the drug epidemics. Meanwhile, a reduction in the demand for illicit drugs and prescription opioids will massively reduce the drug epidemic in North America. Such a reduction may require a targeted and cooperative effort to the US and Canada, as well as cities like Montreal and Detroit.